Alright, thank you for giving me this great chance to introduce our research results, and it's my great honor to publish our research paper in ICUrology. My name is Aram Kim, and I'm working in the Kyeong-Ok University Medical Center, and my principal investigator, Dr. Myung-Soo, he is working in Aram Medical Center. Before I begin the interview, I want to introduce the background of the study. Interstitial cystitis, today I'm talking about that. Suprapubic pain related to bladder filling, coupled with additional urinary frequency. Frequency in IC patients results from fear of the pain. So I want to show the AUA guideline for the treatment, especially in second-line treatment. There are several options for oral medication for pain, such as amitriptyline, cimetidine, and hydroxygen and pentosan polysulfate. But interestingly, there is no oral medication for LUTch, even though pain and LUTch is the main symptom in interstitial cystitis. What does it mean? Patients without pain would show decreased frequency. However, we observed some patients showed persistent urinary frequency after improving pain. So we began this study. I want to say the topic of the study, evaluation of the incidence and risk factors associated with persistent frequency in interstitial cystitis, bladder pain syndrome, and the efficacy of antimuscarinic treatments. So we had three kinds of questions: incidence of persistent frequency, and risk factors of persistent frequency, and also efficacy of antimuscarinic treatment. Material method. Selection of patients. Our study included 171 patients diagnosed with IC, and they had more than 4 points in VAS, and they had more than 13 points in POF, and also they had 12 points, more than 12 points in ICQ. And the patients were first divided into two groups according to the presence of pain after conventional treatment. Improved pain was defined as less than 3 points in VAS after 3 months of conventional treatment. And we identified patients who had persistent frequency, which was defined as urinating more than 10 times per day. To evaluate the efficacy of antimuscarinic treatment, the mean frequency before and after the medication was compared. Efficacy was assessed as a reduction in frequency in a 3-day bleeding diary. So now is the result. As you can see, the enrolled patients showed severe symptoms at baseline, but after the conventional treatment, the patients showed improved symptoms about them. So this is the selection process to identify the incidence of persistent frequency. There are total patients, and there we can divide into two groups of patients after the conventional therapy. Almost 80% of patients showed improved pain after conventional treatment, but there are two groups of the patients, which means just 45% of patients showed improved frequency after conventional treatments. And we can see the persistent frequency incidence. Almost 55% of patients showed persistent frequency after the conventional treatment. So this is the incidence of persistent frequency. And also we want to identify the risk factors of persistent frequency, so we compared four kinds of variables about body volume and maximum blood flow rate and maximum blood capacity and frequency per day. These four variables were significantly different between two groups. this group and this group. And also we performed multivariate analysis to reveal the independent factors. As you can see, urinary frequency at baseline was only one independent factors about persistent frequency. And the final result is the efficacy of antimuscarinic treatment. There was no significant difference between patients who took antimuscarinic treatment and did not treatment. So this is our conclusion. About half of the patients who undergo conventional therapy will show persistent frequency if they have poor bladder function, such as low bleeding volume, low Qmax, and low maximum bladder capacity, and severe frequency. Moreover, persistent frequency is not effectively treated with antimuscarinic drugs. So thank you for giving me a great good chance, and thank you for listening.